required to address the issue in respect of the unemployment fully. And a permanent solution is required. So let us take an example. ASHA workers, other workers, what is the security of their employment? If the scheme is abolished, they have gone. As you know, if under any project, some employees are appointed, whether it's a contract labor, another labor, project is gone, workers' future is gone. That will not address the issue. A permanent solution is required for the resolving the unemployment problem itself. Sir, average literacy rate is 76.32%. Still, 30% of the patients suffer from infectious disease like tuberculosis, malaria and diarrhea. Infant mortality rate is 26.619 deaths per 100 live births. 40% of these patients suffer from chronic diseases like diabetes, hypertension, etc. There is a shortage of 1.5 million doctors in the country. And 1 million auxiliary nurse midwives. Total employment in manufacturing sector has come down to 11.5%. Availability of the doctor is a great problem. Sir, from 2009 I have been elected. From my MP development quota, in 6 municipalities, they run the municipal health center, hospital. From 2009, I am contributing from the MP Development Fund to these hospitals. In their ICCU is there. Every modern things, infrastructure, machineries, all are there. You know, the problem is, I am not getting one cardiologist for these purposes. They are very interested to work only in the city. No one is interested to go in the Mapastals area and the rural areas. Therefore, medical education policy is also required to be looked into, revisit. Everyone, mandatory provisions should be made in the legislation that everyone should go to the rural places, Mapastal areas. Country is spending the money for them, whether it's the central or whether it's the state.
And you are also giving.
We are also giving. Sir, you are also giving. We are all also giving. MLA, MPs are giving.
Correct.
No, so far the education is concerned, when they go to the medical colleges, etc., either center is contributing or state is contributing. After 10 years, they are leaving their government service and going into the private practice. And they are not going to anywhere. So this is a very, I am saying, this is a very common problem in everywhere. This has to be addressed properly. Sir, India is one of the growing economies. No doubt about it. But the benefits are yet to fully reach to the poor peoples of this country. There are 92.4% informal workers with no written contract, paid leave and other benefits. 58% of the workforce are self-employed and is not self-entrepreneurship, rather is distressed employment in the country. If GDP growth is 7.6%, then why consumption growth is restricted below 3% in the last year? The household consumption expenditure survey reported that the monthly consumption of the family in the rural areas is rupees 3,094 per month and rupees 4,963 per month. Sir, I support one of the things has been said by the Honorable Finance Minister. I know very educated person may disagree with me. I don't mind for that. Because I am coming from a Mafosal area, read in Pathshala, raid in Mofussil School, raid in Mofussil College, raid in Law College. It is not correct that the persons who are only coming from Oxford and other universities, Cambridge universities, they will govern the country. They are the best materials. I can see that if one reads in presidency in our St. Xavier's, Jawaharlal Nehru University, they suffer from superior complex. They don't consider the students of the rural areas and the cities areas that they are at all students. They think that they would govern the country. No, it is not accepted. ब्रिटिश तो चला गया सर, लेकिन आदत हम लोग का नहीं गया माथा झुकाने के लिए. That way, I don't agree with this. I agree with the Honorable Finance Minister. We must look into the see first the students who are coming from the rural village, reading in college, and they are not less intelligent than the other students. Yes. They may speak in very good English, but their views to disrespect the Indian students of the India, those who have read in village, Mofussil colleges, this is not correct approach.
Yes, yes. Make it brief. Make it brief. Rudy साहब,
आपने ही बोला है मिस्टर रूडी.
He is not yielded and
this is not this. Please, Mr. Modi ji, sorry, Rudy ji, आपने ही बोला है.
कल्याण बनर्जी.
I am disagreeing. No, आप लोग कोई नहीं बोला है. I am disagreeing with someone, sir.
Now, if I have given time to you,
तो बोलने दीजिए सर.
You must address to the chair.
Yes,
why you are taking cognizance of Rudy ji?
I am sorry, sir. Now, this is the point. All students have to be given a same footing.
And already you have taken 10 minutes. So
correct, sir. I have not taken even 4 minutes.
10 minutes.
Four, five minutes. सर बोलने दीजिए ना थोड़ा. अभी तो आया. थोड़ा बोलने दीजिए सर. सर सुनिए.
एक बात को एलुबरेट कर रहे हैं.
नहीं.
कई पॉइंट्स आपके हैं.
सर,
थोड़ा ब्रीफ कर दीजिए.
We are opposing this imposition of 18% GST, charging LIC and health insurance. We are opposing this. Now, main question, core questions comes now. Always it is said that the center is giving this to the states, center is giving this to the states. But how much the center is collecting from the states? On the ground, on the account of the income tax, direct taxes, GST, indirect taxes. I give a few statistics. I will not use the expression figures. Since Mr. Mahatab is there, he knows why I will not.